Even though the Wuhan coronavirus, COVID-19 pandemic has long ended, the U.S. Centers for Disease Control and Prevention, CDC, continues to stoke fear and exercise control through its traveler-based SARS-CoV-2 Genomic Surveillance Program, which has now expanded to 8 international airports across the U.S. Launched in September 2021, the CDC's Genomic Surveillance Program was designed to monitor travelers, whom the agency views as a critical group for tracking new and emerging infectious diseases. Initially rolled out at 3 U.S. airports, the program was expected to be phased out as the COVID-19 crisis waned. However, instead of shutting it down, the CDC has nearly tripled its scope. The CDC announced plans to station public health professionals at 8 airports, including John F. Kennedy International in New York, Newark Liberty International in New Jersey, San Francisco International in California, and Hartsfield-Jackson Atlanta International in Georgia. We aim to accomplish several goals: establish the platform at 3 airports, assess participation levels, and determine our ability to detect variants through pooled sampling, said Cindy Friedman, chief of the Travelers Health Branch of the CDC's Genomic Surveillance Program. We met our objectives and demonstrated proof of concept. First, it's voluntary, then it becomes mandatory. At gunpoint, in collaboration with ExpressCheck, an airport-based COVID testing company, and Concentric by Ginkgo, a network of over 60 labs with genetic sequencing capabilities, the CDC intends to continue swabbing travelers' nasal cavities and other orifices to detect COVID germs. The CDC applied this approach with the Omicron variant and others, and now believes it can do the same with any future COVID mutations, likely to emerge around Election Day. Currently, the program is voluntary, allowing individual samples to be collected from participating travelers who remain anonymous. What the CDC does with the collected samples, however, remains unclear. It started voluntarily in China too, until it wasn't, warned someone on X. Then they welded apartment buildings shut, forced people to get vaccinated at gunpoint, and hauled everyone else into isolation concentration camps, releasing them only if they paid a bribe. They even killed every pet in Shanghai. There are so many reasons I refuse to fly anymore, but if they made this mandatory, I'd be done for sure, another user commented. Someone named Joe Christensen, at JoeChristiansy13, recalled the disturbing events during Andrew Cuomo's handling of the COVID pandemic in New York. When Cuomo tried to introduce contact tracing in New York State, he stationed the National Guard at JFK under the pretext of questioning travelers about their movements, Christensen wrote. I saw them there as I came through, but I never saw them approaching travelers, and the contact tracing was never implemented. I don't think anyone downloaded the app. These psychos collecting airplane toilet wastewater for testing is just sick, another user remarked, criticizing the CDC's peculiar fixation on collecting human bodily fluids for COVID testing. If the CDC is involved, you can be sure it has little to do with improving your health or that of your loved ones.